without further ado, Dr. Andrew Leavitt is the director of UCSF's program for non-cancerous blood disorders, as well as the co-director of UCSF's Hemophilia Treatment Center. He's given me permission to not go down his entire list of abilities and all of his credentials and background, which is quite impressive. But I am going to turn it over to Dr. Leavitt now to discuss COVID-19 and the vaccines. Dr. Leavitt, take it away and thank you.
So anyhow, welcome everybody. And first of all, let me thank the organizers and all the attendees for giving me this really wonderful opportunity to chat with you over the next hour about a very important topic. And I'm very impressed that a number of folks have sent in their questions about vaccination. And so I have in front of me a printed out sheet because I was sent all these questions. And so you'll see me looking down. I'm looking down periodically because I have to read the next question. And the idea is I'm going to go through the questions, every one of them. Some of them I might say, I don't know, but we're going to go through everybody's question that sent one in. And then the remainder of the time will be to take any additional questions if they exist and as time permits. So with that, let me just go in order as they were sent to me. Number one, when I go to get my vaccine, should I take my factor before getting the shot? Fabulous question. So those of you who are in the bleeding disorders community understand the concept of timing, etc. So for example, if I pretend or assume that this, say, might come from someone with severe hemophilia, so that they're on regular prophylactic dosing, it would certainly seem prudent that you make that one of the days that you take your shot, your prophylaxis, and presumably the vaccine won't be 12 hours later. But if, let's say, you have a 3 o'clock in the afternoon vaccine, and that's a day you can or usually do your prophy, I'd take it a little later in the day, take it around noon. Yes, take advantage of the fact that you have the power to normalize yourself and therefore minimize or prevent any complication. So anyhow, so I hope that that answers that question. Now, I just had an idea. So this is a very kind of open flowing process. So if you happen to be, or I guess it shouldn't be restricted. I was about to say, if you happen to be the person who posed the question and my answer is inadequate or unclear, maybe the organizers will allow you to unmute and ask for clarification. I think we probably shouldn't have everybody on that along the way, because I do want to get through all the questions. And once again, maybe you would put it in the chat if you have a question, and maybe the organizers can then send me those questions at the end. Maybe that's a smarter way to go. So you can see this is we're deciding in real time. Okay, there you go. Answer number one. Number two, what exactly is in the vaccine? Like, are there really microchips in the vaccine? Is there COVID in the vaccine? Okay, I'm not going to say every question's great because they are all great. And this is another great question. But for those of you whose questions follow, if I don't say yours is great, that's just because I overlooked. They're all great questions and I'll spare time. So what's in the vaccine? So the vaccines kind of come in two different manufacturing processes. But before we get to that, let me just be super clear. There is not a microchip in any vaccine. There is not a microchip in any vaccine. Two, is there COVID in the vaccine? No, there is no COVID. That is, there's no SARS virus in the vaccine. So put another way, you cannot get COVID from the vaccine, all right? I don't know how I can be clearer, but I will repeat it. There is no microchip and there is no COVID in the vaccine. But now to the first part of the question, what is in the vaccine? The vaccine, though the processes of manufacturing are slightly different, just like you know that factors sometimes are made a little differently. You might have one that's a recombinant, one might be plasma and then treated. So you know that good end products can come through different pathways. And so there are two basic pathways. And the fundamental the thing that matters, is that the vaccine allows for the body to see one of those surface proteins, or what's called the spike protein, on the virus. Now, for those of you who have been paying attention or looking at pictures in the paper, you know, it's called a coronavirus because it has almost like this big corona or or shall we say, like a hat with spikes all over it. And so the spike protein, when you see those drawings, is that thing that sticks out. And that's the critical protein for interacting with a cell in your body and then starting the disease process. So the vaccine is to generate antibodies that prevent the spike protein from binding to the cells in your body. And that binding is a requirement to get disease. So that's it. It blocks being infected. Okay. So I hope that's answered that question. My problem is I'll talk too long on each question, so I'm going to move along. Okay. Number 3, will any of the vaccines make me ineligible for gene therapy later on? I love it. We have gene therapy trials going on. No. Let me try to answer that question again. No. All right. Get the vaccine. We want you vaccinated. Okay. There's nothing more to say there. Okay. 4. I heard a woman in the bleeding disorder community had some serious effects after getting the vaccine. Is it safe for women without an official bleeding disorder diagnosis? So there are many little side effects that people may have, okay? But I'm going to restate this. I heard a woman in the bleeding disorder community had some serious effects after getting the vaccine. And the question goes on to say, is it safe for women to get the vaccine? So I'm going to focus this on the things that have been in the press about women. But any of the side effects, just to be very clear, that have been reported with any of the vaccines are don't care about your gender. Okay, you're at risk regardless, but they are incredibly rare. I don't know if this individual is referring to the amazingly rare event of low platelet counts and blood clots. But absolutely, these vaccines are absolutely safe, okay? Absolutely safe. How do we define safe, okay? You know that if you do anything millions and millions of times, something might go awry with one individual or another. So yes, there are side effects, and yes, people may have a complication. But when we look at the safety, it's really a question of how safe is this versus not getting vaccinated, right? If you look at the risk of getting exposure, the risk of getting disease, and the complications thereof. So from that perspective, these are profoundly safe vaccines, profoundly safe vaccines. That being said, we are remarkably lucky to live in the United States, okay? Remarkably lucky. There are countries where there isn't even an option, right? They don't have the vaccine. We have multiple flavors of vaccine. We have multiple types of vaccines. This is really remarkable. It's like someone who doesn't have any food at the table versus someone who's at a buffet table. We are very fortunate. And therefore, while I am not going to rank order what people should do, I think the principle you need to hear is that because you have this luxury, don't get one that worries you more than another and get the other. It's not about don't get any because one worries you. You need to get vaccinated, but you have the luxury. And unfortunately, that luxury has increased lately because fewer and fewer of the vaccine appointments are being taken. So the ability to rapidly get what you want has gone up dramatically in the last 2 or 3 weeks. So I hope I've answered that question. 5, if I already had COVID-19, do I need the vaccine or am I immune? Another brilliant question. So you may be immune, okay? And I don't know if you are, but I do believe that the scientists at the CDC are remarkably careful and thoughtful and make all their decisions based on the hat that they wear, that they are public health officials and they need to make decisions that are for the global good of the public in the United States. And their recommendation is to be vaccinated, even if you've had infection, but they give you a time frame. I believe, but did not double check and do my homework right before this. It used to be 90 days after your, whether it's your recovery or your infection. So a few months out, we do recommend that you get vaccinated, okay? And there is zero known harm of doing that, okay? 6, Will the vaccine give me COVID? Is that why people get sick after they get it? Will the vaccine give me COVID? No. Let me say that again more clearly. No. All right. Let me say it more loudly. No. All right. So in case anybody fell asleep. All right. So, and that is a directly in line with my previous statement to a previous question is there COVID in the vaccine? No. So you cannot get the disease from the vaccine. You can't, no matter what you might hear on some media outlet that you happen to drive by, you cannot. I really want you to hear that. And then the second part is that why people get sick after they get it? Well, so therefore the answer to that is also no, right? What it is that we all know, I mean, for those of us who are parents and our kids get vaccinated, they feel a little more ornery the next day or two. They, depending on their age, they can tell you they just feel a little achy, or sometimes they're so young, you just have to guess that's what they're feeling. You might see that your kid got a fever or something. That's part and parcel with a fraction of patients who will get a vaccine. Because what a vaccine does is it triggers your immune system to develop the antibodies and other immune fighting mechanisms to prevent infection from the real organism. And whenever our immune system is triggered, symptoms of just feeling a little yucky like fevers and aches are part and parcel with that. Okay. Once again, hopefully that is clear. They're great questions and I'm having fun. I hope nobody's fallen asleep so far. Okay. All right. Number 7, when will it be safe to go to in-person activities or events? Okay. Great question. I am going to say, please, please, please follow the guidelines that come from the CDC. This question allows me to kind of highlight something I think is very important. So many people want to be the people making that decision, and so many of those people have no right to make that decision, and they have no background. They're lacking in knowledge of epidemiology, and they're lacking in the knowledge of this particular virus and what we know about it. I strongly urge you to follow CDC recommendations. Okay, and let me just be clear, because everybody, so the Center for Disease Control, it actually has a much longer name, but that's what CDC stands for, is a long-standing government agency that's responsible in large part for why as a country we are as healthy as we are. Okay, so they provide expert recommendations, and caution is clearly, and your health is clearly at the center of their decision making. And I'll double, and let me say another thing. And what you'll notice is those comments change over time. That's not flip-flopping. That's not being inconsistent. That's evolving your opinion based on the new facts and data that come into existence. So you should expect evolving opinions. Okay, that's a good thing. That reflects that they're doing their job correctly. Okay. Boom, boom, boom. Number 8, can I get COVID-19 from my plasmid-based medicine? No, there's nothing more to say. No. Okay. Can I get the vaccine at my HTC? Well, I don't know what every HTC is doing. We do not give the vaccine at our HTC, but what I do know is that there are many kind of websites, and usually links to, say, your county or even the state of California, where you can just, if you were to just punch into your Google browser, and I'm not trying to promote Google over something else, but it's just become a word that we use, right? Like Kleenex. If you put there, it says, where can I get a vaccine? I live in San Francisco. It'll tell you where you can go. And I think that's the smartest thing. So direct answer to the question, we at our HTC do not give them. I mean, it's interesting. There's a Walgreens about a 3-minute walk from our HTC, and they give the vaccine. And you would find that on, if you did what I just recommended online. Okay, great. 10, I had headaches and chills and nausea after my first dose of the vaccine. Should I skip my second dose? No, absolutely not. That is an expected set of symptoms for a reasonable fraction. Don't ask me the percentage. Okay. of patients, of individuals. You're not a patient. When you get a vaccine, you're not a patient, you're a person, right? So for the people who get vaccinated, those symptoms, which really were what I was commenting on a minute ago when I was talking about what your kid might do if it's your kid, and of course also yourself, that it's okay. So we're probably not supposed to talk about ourselves, but here we go. So I read this person's and I go, "Ooh, I wish I was you," okay? Because I got my vaccine and I felt fine. And I thought, "Ooh, I hope they gave me the vaccine." So in some ways, I'd love to have a little evidence that my body said, "Hey, what did you just do to me?" So nothing to worry about, and please get the second dose. Please get the second dose. And just by kind of how you phrase the question, that means that that person got either the Pfizer or the Moderna, because they're the 2-dose vaccines. Okay, let me keep going. When will my kids be able to get vaccinated? So again, I learned that I have no faster knowledge of that than you, because I learn it from looking at the news, reliable news, mind you, and the CDC. So I know recently, but don't hold me to the date and to the specifics, but the Pfizer vaccine was just approved. The Pfizer vaccine was just approved for younger people. And again, I don't recall if the cutoff was 12 or 13 or something, but the vaccines up until recently were 18 and older, or older than 18. I actually don't recall that exact cutoff. But now into that kind of early teenager group is now approved. Now, whether there's a time frame between the government approval and then accessibility, I don't know. But the fact that that came out, if you have a teenager, get right back into that online system I mentioned and find out where the local one is available for your child. Okay. Should I send my kids to school if I am not vaccinated? This is a great question for the following, well, for many reasons, but we all know that there are principles that should guide all of us, but the final decisions about how things are done can be school district specific. Okay, so each school district can have slightly different rules. Okay, and I think what's important is to realize that this is not an individual problem. This is a community. This is a public health problem. So I just recommend, there's only one right answer here. Please ask your school district, which would either be your student's teacher or the principal's office or something like that. I wouldn't want to misspeak. So the right answer to this is, it may be variable. I don't know. And so please ask locally. Okay. 13, do the vaccines stop the variations of the virus? Now, this is a very interesting question. So let me make sure people understand what this question is getting at. Viruses, okay, have nucleic acid, things like DNA. We'll just use DNA as a general term for nucleic acid. And just for those who care, the NA of DNA is nucleic acid, all righty? So and every time a thing, we'll call the virus, replicates, makes another virus, it has to copy that DNA. And the more times it does that, the more chances it has to make a mistake. Okay, so the DNA code might get a little mutation in it. And some of those mutations may be absolutely insignificant to the virus and to the virus causing disease. But on occasion, out of sheer chance, this is not directed, this is not purposeful. Those mistakes are completely random because no system is perfect all the time. And so you can make a mistake just like we can all make a mistake. And so most of the time they're immaterial. They do not matter. But on occasion, out of sheer chance, it makes a change in the virus structure such that the virus can be a little better at infecting somebody. Okay, little better at making that attachment and getting in the cell and starting to do what viruses do once they get into cells. And so let me get back to the question. Does the vaccine stop? So the way, okay, so that's the variation business. And then you'll hear about, oh, there's the United Kingdom stuff, or there's the one I think out of South Africa or various places, and I'm not going to name them, but there are various ones, and they tend to take over the type that's in a vicinity because they have that little advantage. They have that little advantage. So the vaccine reduces significantly. To say prevent is a dangerous term because prevent is an absolute, but it can significantly reduce the chance because the vaccine reduces the spread. And if you reduce the spread, you have fewer opportunities for the viruses to keep making mistakes that are advantageous for them and disadvantageous for us. So the short answer is it does reduce it, okay, because it reduces spread. Okay, I hope that's clear. When you say it yourself, you think it's clear because it's what you said. So we can follow that up if it's not. So that's one of the more kind of complicated answers I think I'll have to give today. Since the trials for the vaccines were rushed, it doesn't seem safe. Any thoughts? So that's an interesting question. And I guess the term rush is in the eye of the beholder. I don't think that they were rushed. I think they were incredibly efficient. And there was a lot of change that was put in place to make the vaccines available sooner, but it had nothing to do with the speed of the clinical trials. It had to do with the fact that the governments around the world, and we'll speak about our own, started many things in progress. Oh, that was terrible. Hold on a second. So typically speaking, let's say there's a vaccine for something, the shingles vaccine or something. That's something you might have heard about. Everybody thinks, well, that would be a good idea. One or two companies say, well, maybe we can do that. And then they go and they get they do their clinical trial. They meet with the FDA to see if it's approved. Then the FDA puts together the committees. Then the people have to do this. So it was, in fact, all the other things besides the clinical trial that were rushed so that the clinical trials, if showing that they were positive, both in terms of efficacy and acceptable safety, that in fact, all those other steps that take years for companies to get to market could be kind of cut through the red tape and done faster. So it had nothing to do with rushing the trial. It had nothing to do with rushing the assessment of the reported toxicities and the safety. There are enormous safety monitoring committees that are completely, and this is important for people to know, all of those safety monitoring committees are people that have nothing to do with the company. Their only job is as public health officials and as informed scientists and healthcare providers, again, whose perspective is the safety and efficacy. So essentially what's good for patients. So there may be a sense of rush in the sense of when it started to get to the end. And I would say that that is because governments realized that they wanted to be able to get this out if it's deemed safe and effective much faster than another type of vaccine might go into market that doesn't have such enormous both national and worldwide public health issues. Okay. So that what I would say was remarkable about it, and part of the reason that people have this feeling, I think, of the rushed quality is that the scientific community has for a couple of decades been very aware of the concerns of pandemics. And therefore, governments and working with companies for our personal benefit have tried to develop platforms or technologies such that if something ever arose, like COVID-19, that they would be primed and ready to start to develop a vaccine. So that's another enormous shortening of process. If we tried to do this 20 years ago, we couldn't have ever gotten even to the clinical trials this fast because there wouldn't be all the technology devoted to essentially, it's like the shortstop who's ready and waiting for the batter who likes to hit the shortstop, right? So it's that kind of a thing. I just made that up. I mean, it's true as an analogy, but hey, it's baseball season, so let's do that. All right, so that's it. So I hope that does it. I don't think the kinetics or the speed with which we went from virus to vaccine should in any way impact one's decision to get a vaccine. Okay. Is there anyone who should not get the vaccine? Boy, so that becomes a very difficult question, okay? That becomes a very difficult question. And without knowing the specific kind of person or situation that one is asking for or asking about, I'm a little hesitant to answer that question, simply because if I say yes, then everybody will think it must be them, and in all probability it's not them at all. So I think if you as an individual have a concern about you as an individual, maybe having a reason why a medical condition should prevent you from getting the vaccine at this time, let's say, that should be brought up with your provider. And certainly if your provider, and whether that's your primary or whether that's your HTC, is uncertain about that, they should have ready access to the kind of professional society recommendations for your specific situation. So there are certainly some situations where people should delay a little bit simply because of a medication that they're on. But I really don't want to look for reasons not to get it. There are so few and far between. Okay. And of course, the one obvious that I will mention is that every vaccine, and when you go to get it, they will ask you if you've ever had a serious adverse reaction to something, and that something might be part of the manufacturing. So just like it is with a flu vaccine, if you've had a certain reaction in the past, they don't want you to have it. So I'm going to leave it at that. I think that one needs to go at a specific situation with the specific provider. Okay. And then I have three more. So that was the first bucket of questions I was sent earlier in the week. And then there were three additions that I got. So we're moving on to now the three additions. And the first one is as follows. For women with a bleeding disorder and who are expecting, meaning who are pregnant, is there any specific precaution they should take when it comes to COVID or the vaccine? And then which vaccine would you advise? So let's go back. There are three questions in there. So if somebody is expecting, what precautions should they take when it comes to COVID? The very same precautions anybody should take, right? Wearing a mask in the right circumstances, social distancing, washing your hands appropriately, etc. So that doesn't change. That doesn't change because those kind of prevention activities are true regardless of who you are. Okay. The next part of it is, does that change any specific precautions should take, let's see, when it comes to the vaccine? Okay. I am not aware of any particular precautions that are specific for pregnant women. Now, the person or people who would have the latest, greatest CDC recommendations, both at their fingertips and on their tongue tip, would be your OBGYN provider. And because, as you recall, as I said earlier, recommendations evolve over time, not because of flip-flopping, but because we learn more. I think people have lost the perspective of how fast we have. Did I hit a button? No. Or maybe somebody unmuted that's not supposed to be unmuted. I don't know. Okay. So we learn so much so fast because the systems have put in place, very, very sophisticated systems have been put in place so that knowledge can be accumulated and then properly disseminated. And so I would say that anything related to that it should be always a question with your OB. And I would imagine, I'm not an OB, so I can't say I know. I would imagine that this is part of a topic that the OB would spontaneously bring up with an individual. Hey, let's talk about the vaccine. Let's talk about protecting you and those around you by getting the vaccine, etc. So I think I should wisely defer to that group of folks. But I know of certainly people who are pregnant can get the vaccine as a general global statement. Okay, it says, which vaccine would you advise? So once again, I'm going to answer that kind of with a two-part question. I think healthcare is best delivered by having that individual you trust and that you work with. And having 7 other people give you opinions is not necessarily advantageous and is more often than not highly disruptive to high quality care. So I would recommend that you ask that question to your OB, because that's the person with you have the relationship and the trust. And that's the person who should be giving you this advice. That being said, I will also go back to another question earlier to say that we are so lucky. We have choice. We have a buffet table. So in addition to them making a recommendation, it allows them to hear your concerns, and together you can decide which one to go with. Okay, I think that's the wisest thing to do. Next, my teenager has hemophilia and he's scared of getting the vaccine. How can I best talk to him or her, it says them, excuse me, about it? So first of all, let me congratulate you for understanding their fears and wanting to help them get through this process. So you said it's a teenager, and so teenagers would only very recently, as I mentioned, has the vaccine been approved for teenagers. I guess the answer to this question would really depend on what he or she is scared of, right? So let me just make a simple assumption of that there might be two possibilities of what they're afraid of. One might be afraid of having a bleeding complication, and the other might be some of the fears that we hear people have about the vaccine itself in terms of safety, etc. Let me reiterate, there is no microchip. Okay, so if it's part and parcel with their bleeding disorder, let me take that into two parts. And you use the word hemophilia, so I can use that as a specific example. If we say it's a severe hemophilia patient, then explain to your child that we're going to do your prophy dose that day, and we'll even move it a little bit later than your usual morning going to school time, and we'll time it a few hours. But you know that peak is going to last a long time, so you don't have to time it to the minute. But fine, if your vaccine is 8 hours later than your usual infusion, move your infusion back, say 4 hours that day. So that's how you could get over that concern, because I think the concern of bleeding is something we must respect in hemophilia patients, because that concern actually helps them protect themselves. So I in no way would want to kind of poo-poo that concern. I would want to support that concern with such advice. Now let's move to our more mild people who aren't taking prophy. I think they fall into two groups, basically. There are folks who don't take prophy, but are very frequent users of on-demand. Say maybe they play soccer and they play it every Saturday, and every Saturday they just take some because they want to protect their joints because they're smart, okay? That individual, you can tell them, well, you can treat this as an activity and we'll just take a prophy dose. Then you have the people who aren't like that, who aren't on prophy and really don't self-infuse or do much of anything, right? Maybe, and again, bear with me, I'm not trying to draw specifics, but maybe they're a 30% or something and they really don't have that need. Maybe they keep a couple of vials in house because that way, if there's a concern, they can take them with them to their local ER so that someone has it. Say you have that person, a non-self-infuser. For those people, obviously, the bleeding risk is much less. With the vaccine, certainly in this country, you get the vaccine and they make you sit there for 15 minutes, and that's part of the safety process because they want to look for reactions that are concerning. I tell my patients, use those 15 minutes and take your opposite hand and apply good pressure for at least the first 10. And if they wanted even more kind of protection against the little hematoma at the injection site, take a few ice cubes, all right, put them in a little plastic bag and put that inside of a washcloth. And when you're holding it, you can hold that there because also the coolness will help also diminish the bleeding consequence. So that's my answer to that individual. I hope I hit the person that is their child with that kind of spectrum of answers. And
so
the
Dr.
last,
Leavitt,
yes.
The person followed up with me in the chat, who had asked that question, and they said the fear is a little bit more of the long run, of it, just kind of it's new, it's unknown, like what's going to happen down the road,
Right.
that's yeah.
That fear, right? Okay, all right, very valid. So great. So I wasted everybody's time. Sorry about that. maybe there was still something useful there for somebody.
Yeah, helpful answers. No.
Yeah. Okay. Very good. So that becomes kind of like a vaccine fear. Well, that's one where you really just kind of have to sit down. I think the first thing I would say, and again, now you're getting an answer that is kind of how I view this through the lens of someone who's been a physician for a long time and trying to understand people. I think the first thing I would say is, well, what are you worried about in the long-term vaccination? You've got your MMR, you've got you've been vaccinated many times, and that has prevented devastating diseases and has been your best friend. In fact, I would argue that it's the most important things pediatricians do, quite frankly, at a global level, is to make sure the kids are vaccinated. We prevent more disease than we treat that way. So I guess it's trying to find out what the fears are and where they come from, okay? Because some of those can come from, and I'm going to say this, from sites or organizations that really don't have your child's best interest at heart, okay? And so I think it's trying to understand that and reassure them. It's hard. That I think is the repeat conversation, and trying to make sure they understand they've had vaccines, reassure them that the clinical trials were not rushed, even though there's a segment of the media that tries to claim that they were. It was all the other process. And I think the other processes, and one that people don't realize that I mentioned, is that as a nation, as part of our effort to protect us, much effort has been put into place with no pandemic for 19 years or 20 to develop something so that when the next one showed up, we would be prepared. That is why the mRNA technology existed. And that particular platform is one that can pivot on a moment's notice and go after the next pathogen. And that's what we saw happen here with breakneck speed, and it's remarkable. So I think trying to explain to them that it's not rushed, trying to explain to them the role of vaccines in that individual's health already in their life, and they probably have no concept of that, quite frankly. So I'll stop there, because this is such an open-ended and important question, but I tend to talk on, and I'll just stop myself, okay? So the last question that I have, I might ask Brian, I hate to put you on the spot, the notes I took, because this was one that I just got this morning, so it wasn't on my printed piece of paper. It says it's somebody with von Willebrand's disease who received the J&J vaccine, Johnson & Johnson vaccine, and they may have had some concerns on what should they look for. I think that was the essence of the question, Brian. I don't mean to put you on the spot.
No problem. Yeah, so they had heard that there was maybe a recommendation that they shouldn't get the Johnson & Johnson vaccine, but they had already gotten it. So what should they, please talk about that.
Very good. Thank you for clarifying the question, because that's a brilliant question. Well, the good news is you got the vaccine. So let me give you a round of applause for that. You got vaccinated. That's the single most important thing you did for your healthcare, whatever month that you got the vaccine. So no, there is nothing to be concerned about that you already got it, and then someone raises this question. That being said, let me say one or two comments about the J&J vaccine. So the Johnson & Johnson vaccine is made with the same technology as the AstraZeneca vaccine. You may not have heard of AstraZeneca because it's not yet approved in the United States, but it's widely used in Europe, okay? You have probably heard of Pfizer and Moderna. Those are a different technology, because those were the ones that ramped out here quickly and have done a great job in vaccinating our country. So the Johnson & Johnson vaccine, as well as the AstraZeneca vaccine, has had a syndrome now associated with it that is of clinical significance. It's enormously rare, but it is quite clinically significant, all right? And so it is an issue of people getting low platelet counts and getting blood clots. It only happens to people, I think there are enough data now that this is pretty safe to say, this happens somewhere between about 6 days and 28 days after the vaccine. So the first comment is, if this individual had the J&J more than 4 weeks ago, then any issue that was behind the comment about a von Willebrand's patient not getting J&J is no longer relevant, because you are out of the window of time where that might be relevant, even though it's super rare, okay? So, but I'll go on, because, so if that's the case, the answer's done, but I don't know how long ago you've been. And so let's just say, it was 2 weeks ago or something. Well, actually, let me pause for a minute. It was on, let me get this straight. I'm looking over my desk at a calendar. Bear with me. I think it was maybe around April 14th. Don't hold me to the date. It's within a day or two that the Johnson & Johnson was put on hold. Maybe it was the 13th, I think, that the J&J was put on hold. So, and then it was released from hold around the 23rd of April. So it was down for 10 days as they reviewed this syndrome. So in all probability, you got it before then, right? Before the 13th. And so if that's true, and today is the 15th of May, I believe that means you are 4 weeks and a day beyond, which means you're beyond the real risk period. Okay. So again, there's a little assumption I made in there, but I'm trying to do it in your best interest. So that's it. Let's just say for whatever reason, you got it 2 days ago. All right. And that's why your question came in yesterday. Then, first of all, do not be afraid. And again, congratulate yourself for being vaccinated. Just like any other vaccine, for the 2 to 3 days afterwards, you might feel that yuckiness like you're coming down with a cold or something. That's nothing to worry about. And then the recommendation for those who have had the J&J, even though it's enormously rare, they don't want people to ignore the following things. Headaches, if you've never had headaches, strange abdominal pains and you don't have these abdominal pains, leg pain or swelling or shortness of breath, or getting bruising that you don't usually get. Any of those in that 6 to 28 day window following a J&J should prompt you to see your physician, who can do a blood test to answer the question if you're in that rare category. Okay, so to summarize, do not worry, because worrying will solve no problem. I prefer you be informed and act intelligently. If you're beyond the window, don't worry about it. Okay? If you're in the window, pay attention to what I just said. Strange headaches, arms or legs feel strange in an unusual way, abdominal pains that are just, where is this coming from? And then leg pain or swelling or shortness of breath, that or bruises that you or bleeding that you don't usually get. The latter reflect the low platelet counts that you can get. So I'm going to stop there. And that is my last question. So first, I will say thank you so very much for tolerating me. I know my team knows I can be very long-winded. And so I will pause and turn it over to Brian, who will tell me what, if anything, we do next.
Dr. Leavitt, thank you very much. It's Andrea from HFNC.
Okay.
We did have a few questions that kind of trickled in. And so anyone that has posed a question that we don't get to, I will apologize. But I'm going to ask, one of our community members had stated that if her mother had unexplained bleeding after her second shot, should she still get it? And she didn't specify.
But should she still do what? If she's had 2 shots, should she do what?
Should she still get the vaccine?
Oh, okay. So if mother had 2 shots and then had some maybe question of bleeding or bruising, should she, our community member, get the same vaccine?
Correct.
Yeah. Oh, absolutely. There's no relationship between the two of you in that regard that we know of. And I guess the question would be, did the mother tell her doctor, and did her doctor get a blood count to see how the platelet count is? Because let me be clear about this.
She has Kaiser, and Kaiser doesn't believe she has a bleeding disorder.
Well, regardless of if anybody had a bleeding disorder, right? Okay. All of us, and again, so this is very distinctly different than the rare J&J thing I just mentioned. So the other vaccines, all the vaccines, in fact, vaccines you've already had, okay, sometimes cause a little dip in platelets, completely unrelated to this more concerning J&J issue that is rare, okay? And so little drops in platelet counts. And in fact, there is an organization that is a patient-facing organization for patients with something called ITP, or immune thrombocytopenia. These people have low platelet counts. And their webpage, which I think is outstanding, provides them with information about the fact that some of them will have dips in their platelet counts. So if they start getting symptoms, which is in them bleeding or bruising or little red dots we call petechiae, that they should seek medical attention to get their platelet count checked, because that is a known thing that can happen. And that can happen whether or not you've had any history of a bleeding disorder or whether you've had any issue of ITP in the past. So I guess my two-part answer is that if she's doing well, that's great, okay, and I hope she is, and in all probability she is. If that happened yesterday, a blood count, a CBC would be certainly a reasonable thing to check, simply from the perspective that anybody is allowed to develop thrombocytopenia after any vaccination, okay? And then with respect to you, our community member, there would be no particular reason not to get the same vaccine. So go get vaccinated. Okay.
Very
Next
good.
question.
Thank you.
Next question.
Another community member had asked, is it okay if you get a rash that looks like a welt and it burns?
I mean, after the vaccine.
Yes.
Yeah, right. Okay. So these little, and again, symptoms are always different. So people can get hives. That kind of sounds like a hive, but a hive typically is described as itching, not burning, right? And so I think and certainly people get rashes after vaccines. That's part of this immune process, this thing. People get hives when they get allergic reactions to things. They might, for example, sometimes people eat some food that they have an allergic reaction and they get these hives all over their body. These look like rashes, little raised things. Sometimes they itch, sometimes they don't. I guess burning could be in that spectrum. It wouldn't be the most classic symptom. I think that, once again, fear and assumption is your enemy, and thoughtfulness and knowledge is your friend. So if you get a vaccine and that happens to you, go drop into your doctor's office and just make sure it's okay if your concern is high enough. If it's just a little thing and it's not really bothering you, I certainly wouldn't go to my doctor's office for it, because little rashes definitely happen after the vaccines. I need to be careful what I say here. I think, I think that it's something like up to 3 or 4 days out. That's all within the spectrum of what the CDC would expect. I hope that answers your question.
That definitely did. And reading further, the individual said it actually happened on the opposite side from where the injection took place.
So that's great. Hives do not happen. Hives are a reflection of a systemic immune reaction and not a local immune reaction. So for example, let's just say I eat strawberries and unbeknownst to me, I have a strawberry allergy. I don't get the hives on my tongue, right? I get them wherever my body decides to plop them, okay? So it reflects a systemic, not a localized reaction.
Very good. Okay, thank you.
Mhm.
A community member said that her teenage son has von Willebrand and has a tumor. Will the vaccine affect his tumor and possibly make it grow?
So a couple parts to that question. First of all, I'm sorry your son has a tumor. And I hope everything goes well, which happens with many tumors. I think that is a question about the relative risk benefit about vaccinating now and when to get vaccinated relative to any treatment for the tumor should be a question asked to and answered by your son's oncologist. Okay. Again, getting back to my comment that one thing that both the public and professional people like me need to realize, your opinion is valued in certain circumstances and not in others. And so I think in this
Dr. Leavitt, you muted yourself.
oh my God, I don't know how that happened, but it just goes to show you weird things happen in the world of Zoom. So I hope, was that for a long time?
Just the last 5 seconds.
Oh, okay, great. Well, I spared you 5 seconds of my voice. So I think it's that, and I think there's another teaching point here, or not teaching point. I do run a lot of classes. A good, useful patient advocate point is, if you have a question that you think is an important question and you go to the doctor's office and then they didn't bring it up and you leave and you didn't ask it because you thought, well, if it was important, they would have talked to me. Absolutely not. Okay. Nobody thinks more deeply about you than you, even though your provider is trying to think very deeply about you. And so this is, again, long-winded over here. Ask your provider. It's a very, very smart question.
Thank you. We have a community member that said, what other vaccines that use mRNA technology to manufacture are currently being developed?
So I don't know. I do not know the world of vaccinations. What I can tell is the technology is on the newer side, but I do not have that answer.
Ashley, I'm going to ask if you've moved further down the question list, if you want to go ahead and jump in on this.
Ashley Gregory?
Yes, Ashley Gregory, sorry, because I'm trying to read down the list. Just so that the community does know, we won't be starting the breakout sessions until 11:15. It's currently 11:05. So we are fine to ask a few more questions of Dr. Leavitt, and I'm just trying to find other questions.
No,
Great.
sorry,
Okay.
Andrea. My question was in relation to Dahab's follow-up. So yeah, but it looks like Stephanie had a question.
Okay. Okay, I'm going to jump in with another question from community member Dr. Leavitt. If you had headaches off and on daily for a week immediately following the Johnson & Johnson vaccine, but went away, should I go to the doctor?
Okay. So a couple of things. If that's a question about a vaccine you got 6 weeks ago and they went away 5 weeks ago, no, because you're fine, right? But if this is something that in fact is within the last, week or something like that, then my question would, if they went away. So getting headaches right after, again, it's usually that 3 to 4 day period with no other symptoms. So you're functioning fine. The headaches have gone away. Your arms and legs work fine. When you look in the mirror, there's no sagging on one side of your face. No one said, gee, why doesn't your left arm work? That kind of business. You have no other symptoms and they've all gone away and a few days have passed. I don't see a need for that at this time. That being said, informing your physician is not an unreasonable thing. They may or may not want to get a blood count on you. That's a little bit of an opinion space. But I guess I would want to ask back, how many days have the headaches been gone? Can that person possibly chirp back into the chat thing and answer that question?
She has not yet.
Okay, but it sounds like, so I'm going to stick with that. I mean, again, I'm taking it too far, but if they have gone and nothing else has happened and everything is fine, unless they come back, I don't think that there's a big need, because again, headaches in those first few days afterwards are not uncommon.
The community member did say it was 6 weeks.
Oh, great. Then enjoy your day. That's all you need to do.
A community member asked, does it matter which arm you get the shot in?
No. Well, I mean, because some people, well, okay, so here's what matters, all right? So, let's say you're left-handed and you are on some adult, baseball team or something. I'm not a big baseball, it's not like I'm a baseball fanatic. It just happens to be the idea. Maybe you're a tennis player or something, and so you have a dominant arm that is, is going to be taxed in the near term. Well, I'd get it in the other one just because in case it aches, I want to be able to play my sport or do my activity, right? But from an efficacy perspective, no.
Okay, very good. And this is a long question. Well, it's kind of a sticky question. In relation to the argument that the vaccines were developed too quickly as a fear, isn't it true that because it is a strand of SARS, we had a head start on that particular virus due to work on previous SARS vaccines?
So that's very, very interesting. So right, there are SARS-1s and this is SARS-2s. Remember, so we use the term COVID, but 19 and SARS-CoV-2, et cetera, et cetera. So yes, so to that end, knowing about the SARS virus, so the virus that first emerged, and don't hold me to this, about 2001, but it's somewhere back there. I don't, that's not my specialty. And then obviously a lot was then studied about that to understand how that outbreak came. And because of the nature of that virus, there was a lot of work on that family of viruses, because it was reasonable to believe that what happened back then could happen again, and therefore to be informed. So this is part of this trying to get ahead of the curve, doing research because you think a problem can happen versus doing research about a problem that just happened, right? And so that's how we can stay ahead of the curve. So yes, but that being said, of course, a lot of technology in DNA sequencing that has evolved over the last 2 decades, where you can get your genome sequenced, it seems so quickly, et cetera. So that DNA technology could be rapidly, they knew the sequence as soon as they had a sample from somebody. So that's hugely powerful. So all that together does move us forward. So you're right, it is standing on the shoulder of the technology developed the day before and the week before and the year before. And that's how good science goes. You keep building on what you do and leveraging that to your advantage.
Very good. Dr. Leavitt, do you believe that we will be required to get our 6-month boosters?
I am not a vaccine expert nor a public health expert. I do not know. And for one, if they tell me I should get it, I'll go get it. Okay. And if they tell me I don't need it, I won't hound my doctor to do it. Right. So that's how I'll do. I will follow the guidelines. Yeah.
Very good. Dr. Leavitt, it is now 10 minutes past 11, and we do want to give a little bit of a break in between starting our first round of breakout sessions. I know the community cannot thank you enough for your time this morning and the information. It was just incredible. And everyone, as Brian mentioned before, has been putting into the chat just how amazing and charming and how much better informed they feel now that they have heard from you. So thank you very much.
Quite frankly, the kind words, of course, warm my heart. But most importantly, and the thing that makes me happiest, is that I heard you say people feel more informed. And that's what I want to do. I want to have an informed community, because an informed community is the first step to a healthy community. So thank you for your time, and I will let you get on to what sounds like a very exciting day.
Thank you.
Bye, everybody.
Bye-bye.